Today I'm going to talk to you about the components of an exercise prescription or an exercise program. Some of the objectives that we will talk about during this presentation, we'll go through the benefits of an exercise program. I want to discuss the components of an exercise prescription, go over the recommendations for specific programs, and give you a few tips for following these guidelines. So some of the major benefits of exercise, these aren't all of the benefits, but some of the more important. Increasing the strength of the heart, helping decrease resting blood pressure levels, decreasing the risk of developing atherosclerosis or hardening of the arteries. Exercise will help increase your HDL, your good cholesterol, and decrease your triglycerides. Helps improve your energy level, alertness, improves your blood glucose levels, decreases your weight, increases muscle mass, improves quality of life, decreasing depression, stress, and also decreasing your risk of osteoporosis. So what is an exercise prescription? An exercise prescription is basically an exercise program that's designed by an exercise specialist or a doctor in order to help you achieve maximum benefits from exercise and reach your established goals. It also helps ensure that you are working at a safe and appropriate level. When we prescribe an exercise prescription, we typically follow what we call the FIT principle, F-I-T-T. It's similar to how a doctor would prescribe medicine to you. So when you've prescribed a medication, you want to know how often you need to take that medication, which is the frequency of your exercise. You want to know how much or the dose of that medication that you're taking, which would be the intensity of your exercise program. You need to know how long you're taking that medication for, which is how long you should exercise for. And you need to know what kind of medication you're taking. And in this FIT principle, T would be the type of exercise that you're doing. So going over frequency, again, this is the days a week that you need to exercise. In general, the American College of Sports Medicine recommends that you exercise 3 to 7 days a week. Again, this is going to be dependent on your goals. The more days per week that you exercise, the greater benefit you're going to get from it. The I from the FIT principle stands for intensity. This is the level at which you should exercise at. Usually we'll prescribe a moderate intense exercise level. This can be monitored by one of 3 ways or a combination of all of them. One is the target heart rate, 2 is watching your rating of perceived exertion, and 3 is following the talk test. In general, moderate intense exercise means working hard enough to raise your heart rate within your target heart rate range. You may possibly break a sweat, but you still should be able to carry on a comfortable conversation. Finding your target heart rate range. Okay, this is a formula that's used. It factors in your age, your resting heart rate, the level that you want to exercise at, the level that you're at already, and any medications that you're taking. For instance, if you are on a beta blocker medication, this formula will not work for you. So what you do is you take 220, you subtract your age, you subtract your resting heart rate, and you multiply that by 60 to 80%, and then you add back on your resting heart rate. This next slide kind of gives an example. So for a 40-year-old individual with a resting heart rate of 70, when you do the calculations, that person would have a target heart rate range of 143 to 158 beats per minute. Rating of perceived exertion is another way that we can monitor exercise intensity. Basically, it's an overall feeling of how hard you are working when you exercise. Usually, you want exercise to feel fairly light to somewhat hard, and research has shown that this scale correlates with your heart rate while you're exercising. The other method that you can use to monitor your exercise intensity would be practicing the talk test. This is a simple method of, if you can sing while you're exercising, you're probably not working hard enough. If you can't talk or your speech and breathing become extremely labored, you're probably exercising too hard and need to slow down. Signs that you may be overdoing it while you exercise. First of all, let's talk about what's normal. When you exercise, you should see an increase in your heart rate. You should see an increase in your breathing. You should take deeper breaths and faster breaths, and you may even break out into a little of a sweat. What's not normal, having chest pain, arm pain, or heaviness in your chest, also known as angina, having frequent irregular heartbeats, being short of breath to the point that you can't catch your breath, feeling dizzy, nauseous, or having extreme fatigue or pain. Time is the amount of time you should, or how long you should exercise. The recommendations for this, it would be 20 to 60 minutes. Again, this depends on the intensity of your exercise and your goals. This 20 to 60 minutes can be broken up into smaller sessions of 10 minutes, doing that 3 to 6 times per day. The type of exercise would be the final T of the FIT principle. This is also referred to as the mode or the kind of exercise you're going to do. In order to increase your cardiovascular fitness and maintain a healthy body weight or lose weight, you need to be doing aerobic exercise, which includes walking, jogging, hiking, swimming, biking. Other components of your exercise program should include resistance training, which would be lifting weights using exercise bands or balls. The recommendations for this is that you do 8 to 10 exercises at least 2 days per week. You also want to complete your exercise session with a 5 to 10 minute stretching routine. And then it's also very important to be physically active throughout the day. So adding recreation activity, golfing, gardening, dancing, cleaning the house, doing other things that you enjoy would be other components to your fitness program. In addition to all of this, it's also important that you include a warm-up and cool-down period. The importance of the warm-up is to allow your blood to flow to the working muscles. It helps slowly increase your heart rate, blood pressure, and body temperature, thus reducing your chance of having injuries or abnormal heart rhythms. It's also important to, after you exercise, let your body cool down. Let your body return to a resting state, have your heart rate, blood pressure return back to a normal level. By cooling down, you'll decrease your chance of having dizziness, muscle discomfort, or soreness. So the exact guidelines and recommendations from American College of Sports Medicine for an adult under the age of 60 wanting to achieve health benefits. They want you to do a moderate intense aerobic exercise for 30 minutes, 5 days a week, or a vigorous intense aerobic exercise for 20 minutes a day, 3 days a week. So a moderate intense exercise would be going for a walk, doing that 30 minutes a day, 5 days a week. Vigorous intense exercise could be going for a jog. In addition to the aerobic exercise, they encourage you to do 8 to 10 strength training exercises twice a week. An important note, if you are looking to achieve weight loss or maintain weight loss, you may need to do 60 to 90 minutes of exercise. So the 30-minute recommendation that we talked about before is to achieve health benefits and reduce the risk for disease. In order to get that weight loss, you actually need to spend more time doing the exercise, working to 60 to 90 minutes. For adults over the age of 65 or those with chronic conditions such as arthritis, again, the aerobic exercise components are the same: moderate intense exercise, 30 minutes a day, 5 days a week, or vigorous exercise, 20 minutes a day, 3 days a week. You also want to include the strength training exercises 2 to 3 times a week, perform balance exercises, and have a physical activity plan ready. So some tips for meeting these guidelines. The first one is you can do it in short bouts. So you don't have to get the whole 60 minutes all into one period of time. You can break this up into 10, 15-minute bouts and still get the same weight loss and health benefits. This can help you get in the recommendations if you have a busy day. You can also mix it up. So you can do a combination of moderate and vigorous exercise. For example, if you can have 30 minutes of a brisk walk twice a week and then jog for 20 minutes on the other 2 days of the week, you would still get the same benefits out of the exercise